Northeast Tonight, brought to you by Oil India Limited, conquering newer horizons.
Hello and welcome to Notice Tonight, the show that decodes the region. The whole nation is united, viewers, in the battle against the deadly coronavirus. The Northeast too has heeded our Prime Minister's call for a total lockdown for 21 days. We as citizens have always pressed for our rights. But ladies and gentlemen, let us for once focus on our responsibilities, especially at a time our country needs our cooperation. What we need and are actually witnessing is an unprecedented contract between the state and the citizenry, and this is certainly going to help us all overcome the crisis. In this battle, various segments of the state, like the health workers, the police and other security agencies and the civil society, not to speak of the media personnel and every single citizen, have been working in tandem. But yes, in the limelight obviously are the frontline workers, the health personnel, the police, those engaged in essential services, the media professionals and others. Let us discuss about life and tackling matters in the days of the corona pandemic. I am joined on the phone line by Mizoram Chief Minister, Mr. Zoramthanga from Aizawl. In the studios, I have Assam Additional Director General of Police, Mr. Harmeet Singh. From Imphal, I am joined by Dr. K. Rajo Singh, Director Health Services, Manipur. In Kohima, I have Dr. Nyan Kikon, State Nodal Officer for COVID-19. I may also be joined by Menu Khol John, who is the Principal Secretary Health for Nagaland. And from Shillong, I am joined by Dr. Sinrang B. Wajri from the Najaret Hospital. And from Itanagar, I am joined by Mr. Tar Tabin, who is the Vice President of the Arunachal Pradesh Indigenous Tribes Council. Gentlemen, welcome to Notice Tonight. Let me begin by going straight to you, Mr. Zoramthanga in Aizawl. First of all, thank you very much for joining me on the show, Mr. Chief Minister. Can you update our viewers as to what are some of the major steps that your government is taking to prevent COVID-19? Mr. Zoramthanga.
Well, from the beginning, we had an emergency cabinet meeting, and we took all possible steps for the prevention of the coming in of this COVID-19. And 2 times we have got the cabinet meeting. And after that, before the government of India did it, we had the lockdown all along. And then even before the government of India suspended the airline service, we have already stopped the incoming service to Aizawl Airport. And then the second thing is that we have instructed the people, number 1, charge service should be stopped. All the important meetings and then conference and any other public gathering should be stopped, and we have stopped them before the government of India did it.
Right.
And then after that, we met a task force at the state level, district level, and then the village level and the locality level. And people are helping us a lot, and then therefore it's very important that people should be educated on this matter.
Right.
And even in the international border, we have closed all the international border.
Okay.
Right. And then not only the police, but even the people are a very good sentry. And then they obstructed anybody trying to come into Mizoram from outside India. And so on this matter, people are very helpful.
Right.
And then interstate, we close all the borders.
Okay.
We made some 2-3 entry points and did all the surveys and other things, because essential commodities have to be taken in, and therefore we try to
Okay, Mr. Jerome Thanga, please bear with me. I'll coming back to you shortly. Mr. Harmeet Singh, Assam is the state in the northeastern region that's the highest population of the 45 million people in the northeast. About 33 million are in Assam. My question is, how difficult has it been for the police? What has been the role of the police? Because in any kind of an exigency, any kind of an situation like this, apart from the health workers, it is the police which is also very, very involved in the entire battle against COVID-19 in this particular case. So what are some of the challenges that the police has been facing? What are some of the steps that the Assam police has undertaken?
Wasbir, thank you, for having me here on the show to put forward not only the police's point of view, but also of what we are doing as Team Assam. As our Honorable Chief Minister says, we are working together as Team Assam. So it's not just the police. The health workers are in the front line and we are here to help them. Now, you talk about challenges. The real challenge is actually making people understand that this is not a holiday. This is not an off that you've got from office, but the fact that we are being hit by a worldwide pandemic, as the Honorable Prime Minister has said, which needs to be tackled by breaking the chain of transmission. Human beings have to cut down their contact with other human beings. So, you talk about what responsibility has the government taken, what responsibility have the corporates taken. I want to, through your channel, put out to the people an appeal and a request. It is now time for ISR, that is individual social responsibility. All of you have a responsibility to yourselves, to your families, to society,
right,
to the state and the country. You come out of the house, you unnecessarily interact with other people, you are increasing the possibility of taking back an infection which will hit your own elderly in the house and the children first, and then might hit you. So please cut out social contact. That is the most important challenge today.
Okay, these are very, very significant opening remarks from the Assam Additional Director General of Police. These are busy days for you, Mr. Harmeet Singh. I thank you sincerely for taking time out, and the reason why you are here, I'm sure, is to basically make people aware and drive home a particular point of view. I'm coming back to you soon. Let me quickly go to Dr. K. Rajo Singh, the Director of Health Services in Manipur. Dr. Rajo, there are 2 positive cases in the northeast so far. One of them, unfortunately, is from your state, that is Manipur. So has it generated awareness? Are you happy with the awareness level of the people today?
Yes. We have already started awareness program before coming this case in the state of Manipur. We have already started all the measures since January, just like the screening at the screening points like airport, in 3 points, and other border areas of Manipur. And we have given the training to all the health workers, and we have formed the rapid response teams for all the districts of the Manipur. And so we have given educate training and with the training for how to use the protective materials by the health workers.
Okay. When you say protective gear, does the state have sufficient protective gear for your frontline medical staff?
Yes, we are having educate protective materials, equipments, just like face masks, goggles, spectacles, and caps and gown and this foot covering and all those things we are having, and all these equipments we are having, and we have distributed, we have allocated to all the districts for all the health workers of the respective districts. We are having 16 districts. We have distributed all these equipments to all the respective districts, and we are ready to face any consequences because of the consequence of this infection.
All right, I'll come back to you. Just give me a few minutes. I'll come back to you very soon, Dr. Rajo. Dr. Nyan Kikon, the Nodal Officer COVID-19 in Nagaland, you know, I mean, a lot of people are, you know, talking about preparedness. Now, Nagaland, we are talking about the healthcare system. Are you confident? What is the level of awareness? Are you satisfied? Today is second day of the lockdown. Are you a happy man about the awareness? What do you think?
Thank you very much, Mr. Wasbir, for having me on your show. And through your platform, we are also knowing much more about what is happening in the other parts of our sister states. So to come back to your question regarding the awareness which is happening in our state. So even before the lockdown, our state on 22nd of this month, March, we had a partial lockdown. Subsequently, the lockdown happened and we are in the second day. So as of now, the awareness level which is going on, we are trying to reach out to each and every villages, and we are also tying up with various agencies of the government departments so that we can reach to each and every person in all the villages, keeping in mind that social distancing is also an issue here. So
right.
Reaching out to the people on one-to-one basis, keeping in mind the social distancing etiquettes are practiced when we do social awareness
right.
also.
So
yes.
What about how many samples have you tested so far? How many samples, and you know, how many people are on quarantine as far as Nagaland is concerned?
Okay, at this present moment, we are still tabulating all the data, all the people who have come back to Nagaland, not just the Nagas, but citizens of Nagaland. So at this present moment, as of 4 p.m., we have around 2,194 or something, which have come back, which we have tracked and which are spread in all over the districts of Nagaland. As of now, we have sent 11 samples. 5 samples reports have come to us. 6 are awaited. Of those 5, all have turned out to be negative.
Okay. Now, these 2,194 people, are they under quarantine? Have they been quarantined?
Yes, this is the message has gone very strictly from the highest level, from the Honorable Chief Minister, the Honorable Medical Minister, and plus from the Chief Secretary, that this is not a holiday, but this is, if you love your
right.
family, if you love yourself,
yes.
if you love your community, you have
absolutely.
to be
That is the message. That is the message. Right at the beginning of this show, the Assam Additional Director General of Police, Mr. Harmeet Singh, has put out, you know, this is not a holiday, please be indoors, save yourself, save your family, save the nation, and of course yourself. I'll come back to you in a minute. Before I come back once again to Mr. Joramthanga and Harmeet Singh, Mr. Tar Tabin, you know, as a tribal leader, as a community leader, Mr. Tabin, what is the responsibility of people like you, organizations like yours? Have you succeeded in telling the people in the remote villages of Arunachal Pradesh? It's a very vast state. Mr. Tabin, can you hear me?
Yes, yes, please. This is in fact a big national service initiated by Northeast Life. As a civil society, we have already initiated press releases making awareness to the people for prevention of this disease by isolation.
Yeah.
What ADG Sahab has said, Assam, individual social responsibility is the goal of the hour now. We have to, every one of us have to bear this responsibility. And on 23rd, we have issued a press statement. There we have suggested some regulatory mechanism to be enforced by the government, like mandatory isolation.
No, we all know, Mr. Tabin, see, these mandatory things we know. What about the people in the remote villages of Arunachal? What is your information? Are they aware today? Have you been able to, you know, make the people in the remote villages?
Yes. We have our volunteers in the village level also, in the block level also, in the district level. These our organizations are disseminating all this information about this fatality of this disease.
Okay. All right, I'll come back to you. Dr. Sinrang.
We have our organizations.
Okay. Dr. Sinrang Warjuri, I mean, what is the situation in Meghalaya? How is Shillong behaving? What is the behavior of the people in Meghalaya as far as the lockdown is concerned?
Yeah, so the lockdown is hugely successful. I think the streets are empty, only essential services are ongoing. And at Nazareth, where I work, the OPDs have largely closed. There are no one coming for very minor complaints. The ones who are coming to the hospitals are only emergency people who need emergency help, and the essential services are continuing. Most of the people are staying indoors. Looks good. I think if we can sustain this for 21 days, it'll have a big impact. We can actually break the chain.
Absolutely, we need to break the chain. I'm coming back to you, Dr. Wasbir. Coming back to you, Mr. Harmeet Singh. I'm going to the Mizoram Chief Minister in a while. I'll ask my producers also to pick up those two visuals. There are two distinct visuals emerging in Assam, Mr. Harmeet Singh. One, police, beating up, or rather police, trying to chase away people who are out on the streets. There are a lot of people who are displaying, unfortunately, very, very irresponsible behavior in parts of Assam today. That is one image. The second image is of the Assam police feeding. Assam policemen feeding. See, these are two stark images, viewers. Assam police embarked on an unprecedented social service, unprecedented humane gesture on my left. That you can, on the left of the screen, you can see the Assam police personnel feeding the destitutes and those needy. And on the right hand side, you can see they have busted, they are beating with sticks. Harmeet, can you explain what is going on? We can come back to the screen. We can have the visuals as well as Harmeet on the screen. Yes, Harmeet.
Wasbir, the police across the world, not just the country, is the favorite whipping boy of everybody. But if you look at the specifics of all the visuals that have come out, in fact, I'd like you to look at the specifics of this particular visual.
Yes.
We'll come back to the feeding or relief operations later. The gentlemen, if I may call them that, who have been caught in this visual, had come out of their houses to sell illegal liquor, sulai, as it is called in Assam. Now, there might have been an instance here or there where someone on the ground went a little overboard, but that action will be initiated if anybody has done that. But in this instance, and in most of the instances yesterday, what has happened is either people are not ready to listen, or it's mostly people coming out to sell illegal liquor.
Absolutely. We'll also put out visuals of those crowded marketplaces today. How do you deal? Those marketplace visuals. I want those visuals on the screens where there are crowded marketplaces, not the feeding visual, the crowded marketplaces. During lockdown, there are a lot of people who came to the streets, all the markets. See, this is, Harmeet, what do you explain? What is this going on?
Okay.
People are just not listening.
Okay, so, I started the program by saying individual social responsibility.
Absolutely.
Everybody has to understand that they are protecting themselves and their families. It's not as if the virus cannot catch them. The virus can catch everyone. Yesterday you saw that news. I don't think anybody lives as isolated as Prince Charles of the United Kingdom. Prince Charles of the United Kingdom has contracted the virus. So please isolate yourselves. Now, coming back to the other visual that you showed a little earlier, it's actually important. Since yesterday we started relief operations across the state, Nagaon police went in and fed people or gave food grains.
We will devote a chunk on the relief operation. We'll come back to that relief operations. Yes, these are some of the visuals. We will talk extensively on the relief operations, but basically, Harmeet, if the people are crowding the marketplace, despite appeals by the Prime Minister, despite appeals by our Chief Minister and the Health Minister and all of us in the media and you in the police, including the DG, Assam Police, Bhaskar Jyoti Manta, yourself, everybody has been appealing. Still, despite that, these are the scenes. Not only these are the scenes on the remote parts of Assam, but even in Guwahati's Fancy Bazaar, people just throw caution to the winds. We'll talk about this. Let me once again, let us have the normal OC playing. Let's go to Mizoram once again, where, Mr. Joramthanga. Mr. Joramthanga, after the first positive case that has been confirmed from Mizoram yesterday, does this patient has a travel history? Has he traveled anywhere outside the country? Of course he traveled. but let us hear it from you.
Yes, he's a pastor, a Baptist church pastor. He went to Netherlands to get some of his doctorate papers and other things. And he returned, I believe, on the 16th of this month. And then got infected maybe from the Netherlands. But as soon as we identified him, we put him in that special hospital in our medical college together with all his family members. And we have done a lot.
All right. Now, Mr. Joramthanga, how many people have been quarantined, following this particular case of the Mizoram pastor who had tested positive for COVID-19?
Yeah, you see, those people who can make a quarantine in their own home, we let them go home. But before doing that, we ask the villagers or the local people, this person is detained here in the border, so he needs quarantine. Please see whether in his house there is a place where quarantine can be done. And if we get a positive reply from the state task force, then we set them and we set him free and we let him go home to do the quarantine in his house. Otherwise, all the other people were put in a separate quarantine that the state is having. Well, I believe that they're not much now. Maybe, I'm not sure about in hundreds.
Not much now. Joramthanga, now there is the lockdown. In this lockdown period, what are the steps your government is taking to provide essential commodities to the people who have been confined to their homes?
Yes. Number one, regarding the shores, because Mizoram is a landlocked and we have to get all the important essential commodities, mostly from Assam side.
Yeah.
So for the land route, and we permitted those vehicles which carry the essential goods only. But as far as the inner line permit and other entries are concerned, we totally block everything, number one. And here in the locality, the task force are having a duty everywhere in different localities and villages. And then they open 1 hour, 2 hours, depends upon, for purchasing the essential commodities from the shop. And then they permitted the shop to be open only on that occasion. Otherwise, all the shops are closed.
Okay. I'll have to let you go, Mr. Joramthanga, but do you have sufficient food supplies or essential food to give to the people of Mizoram?
Yeah, at the present, I think we have the food supply for about some 3 months at least. So, and at the same time, for the BPL and AAY, these constitute about some 50% of the Mizoram supply receiving people. We are going to give them free for the whole month, for the month of April, for the BPL and AAY.
Okay.
Half of the population.
Right.
We're going to give them a free supply.
Okay, for my viewers in Mizoram, you have heard from your Chief Minister, Joramthanga, that there is enough food supplies for 3 months, and they are also going to supply free essentials to the people in view of the crisis, so there is nothing to worry. Mr. Joramthanga, thank you very much indeed for speaking to me on Northeast Tonight. Let me quickly go to Manipur. Dr. Rajo, now that, one patient has been confirmed, a 23-year-old girl who had come back from the UK. Now, what about quarantine for the family members? Have you been able to trace out everybody who must have come in contact with the girl?
Yes, all the family members, 12 family members have been taken to the designated quarantine center at the same district, and all the members, all the passengers inside that flight, we are searching for all of them. We are able to trace all of them, and all are there under quarantine at a designated place. And we are trying to trace the others members we are taking the history, and when we are trying to find out all the others contact persons through the telephone and with the help of the policemen at present.
Okay. Okay, I'm coming back to you shortly. Dr. Kikon, at the end of the day, how motivated is your medical personnel, your nursing staff? What are you doing to keep the morale high? What are the circulars? What are the instructions?
As mentioned by you in the beginning of the program, that these are unprecedented times that we are facing, and in this regard, from the highest level of the government, messages have been sent, are being sent to all our healthcare workers that this is an unprecedented time where such situation have never befall on any one of us, and that this is the time to challenge ourselves so that we can be of service to the people, to give our best, and in that manner, yes.
Absolutely.
So in that manner, the response, yes.
Response has been tremendous. That's what you're trying to say. Response has been good. This is the case. This is the story from the entire Northeast. People are really dedicated and moving shoulder to shoulder with our Prime Minister and the government in battling the disease. Mr. Tabin, what is the role of the community? Mr. Tabin, community leaders, the Gaon Budas, the village elders, the village chiefs, what is their role? What is their responsibility?
Here in Arunachal Pradesh, Arunachal Indigenous Tribes Forum is the highest civil society in the state. It is a federation of 26 major tribes. All the apex board is 26 major tribes. It's a federation of major tribes. Down the line, we have community-based organizations, the youth wing, women wing. They are all informations are passed on them by social media. And we have issued a press release. What exactly I want to tell, we have made out some regulatory mechanism suggesting the government and the people what we should do. Firstly, we ask for the compulsory isolation of the people coming inside Arunachal Pradesh for at least 10 to 14 days, and strict implementation of the lockdown orders should be implemented in
strict implementation of the lockdown. I'll come back to you. I'll come back to you. I have to go for a break. But Dr. Wajri, isolation facilities, quarantine facilities, are there enough such kind of facilities? What about gear, equipments for the doctors? Dr. Wajri.
Yeah, so we have the isolation here in Nazareth, and they also have it in Nigrams. We have 7 beds plus 35 beds kept for in case if we need to isolate. And even Nigrams has good enough beds, but we still don't have any positive cases here right now. We're screening patients as they come. But I think it is not enough. If an outbreak does occur anywhere in Meghalaya or for Northeast for that matter, or India for that matter, I don't think we're well equipped enough to handle such a scenario. Our health system is overburdened as it is already, and I don't think we'll be able to sustain a very long battle against this.
Very important
for us to follow this shutdown. Yeah.
Yes. So as Dr. Wajri is saying, our health system.
Here
absolutely, Dr. Wajri. I'll come back to you. Dr. Wajri is basically saying that the health system is already overburdened. If there is an outbreak, it will be really, really tough to handle. Therefore, the moral of the story, adhere to the norms forwarded by the Indian health authorities, the state governments, and follow the lockdown which has been announced by the government under the leadership of Prime Minister Narendra Modi. I'll go for a short break. Don't go. When I come back, I'll talk in depth with Mr. Harmeet Singh on some of the major initiatives of the Assam police and, of course, the state government. welcome back. Welcome back. Let me go direct to Mr. Harmeet Singh, the Additional Director General of the Assam Police. Mr. Harmeet Singh, you know, police playing a very major role, not just in Assam but everywhere. But let's focus on Assam. Assam Police is a 70,000 strong force. It has, you know, many plus points already on various issues. But now you are dealing with an extremely unprecedented and a different kind of a situation. How are you coping? What is the road ahead? What are some of the steps that you have put into operation in the last couple of weeks?
You know, Wasbir, as I said earlier, it's not just the Assam Police or the health or this transport department or food and civil supplies. It's Team Assam that's working together.
Right.
So let me start first by saying that you've seen how our Honorable Chief Minister is out on the ground himself. Today he's in North Bank and Upper Assam inspecting facilities. Our Honorable Finance and Health Minister is out there setting up hospitals, setting up quarantine centers. Today he was at Sarusojai inspecting the setting up of a new quarantine center. You know, our teams are there together, the health officials, the district officials, the food officials, right from Shrierampur Gate and Baksir Hat in Dhubri, from where the essential commodities are coming in, from where the medical equipment is coming in, till looking at people. You know, we have tried to trace every person who has come from an affected or infected area and or has the possibility of an infection, have that person checked, have that person put into quarantine. In fact, at this point, I come back to again individual responsibility and request people, if anybody of your family or your friends or your locality has come from abroad or any of the affected areas and has not quarantined himself, please inform the authorities. This is not a complaint. You're doing it to save that person, to save his family,
Right.
to save your own locality.
Right. Now, Hardy, you know, Assam Police has also launched relief operations. In the last 24 to 48 hours, your officers, your men are out on the districts. I have seen in the social media, your boys are distributing rice and other essential commodities. Today we are aware that your team is distributing cooked food to the destitutes and the needy on the streets of Guwahati in collaboration with some of the NGOs. Can you give us a brief details on what's going on as far as relief is concerned?
You see, you yourself said, Wasbir, that we are 70,000 strong, plus we have some paramilitary forces with us, plus we have some of the home guards. Whatever it is, we have a lot of manpower which is out there on the streets. But we also had manpower which wants to help. After all, every policeman is a part of society. So what started yesterday with Nagaon police going out in Juria and giving food grains, today it has been institutionalized.
These are the visuals on the screen, viewers. Yes, Harmeet, continue.
We've had, you are aware of our Smart Protection Unit, which has won a national award and all. Now, there are no big events happening, there are no VVIPs visiting. So, the Smart Protection Unit has totally been deployed for relief operations. In fact, through your medium, I want to tell the people, any social society organization, any NGO that wants to do relief for the underprivileged, for those in need, can reach out to our DIG, Mr. Imdad Bora, whose number will run in the scroll, and you can contact him and he will facilitate your distribution anywhere, because we cannot have a haphazard system without social distancing. We cannot have a system where this self becomes a cause for causing infection.
Right.
We must organize it, and we are organizing it. We are standing there for the people. But I must again reiterate, we can only help you if you start by helping yourselves.
You have to help yourself. And also, you know, the big announcement from the Assam Police right on the show, Mr. Harmeet Singh, the additional DGP, saying that, you know, any NGO, anybody wanting to provide relief, you can route it through the Assam Police. They have appointed a nodal officer, a DIG level officer, Mr. Imdad Bora. He is the nodal officer. You can contact him. If we have the number of where to contact, how to contact Mr. Imdad Bora, we can put it on our ticker. If we already have it, we don't know. I think that number is there. Anyway, we'll see that people get. I think this is a very unique initiative that the Assam Police has taken. Do you remember in your long career, Harmeet Singh, of the Assam Police doing any such thing in the past?
Wasbir,
feeding people.
Well, at different points of time, the Assam Police and the government has fed many people. we are not just feeding us, we are not saying we are feeding, we are helping everybody reach out and feed. But then we are in an unprecedented, unheard of crisis. And if we all don't stand together, who will? So we must ask society to stand together. The Honorable Prime Minister has appealed
Absolutely,
to people to look after families around them. We can facilitate that. So please, as I said, help us, help you, help the government of Assam in helping you, because if you don't help yourself,
who will help? Now, I would also, on my own behalf and on behalf of Northeast Live, we'd also like to thank various NGOs, including the Fancy Bazaar Gurudwara Sahib and PISA, for assisting or collaborating with the Assam police in carrying out this relief operation. This is only the beginning, and there will be a lot of NGOs, there will be a lot of individuals who would like to provide relief to the needy, to the destitute, to the poor people. I think that is a very big initiative. I'd like to go to my other panelists before we talk about some of the other unique steps that the Assam government has taken. Dr. K. Rajo, if you can give us an idea, what is your contingency measures? What is the number of health personnel in Manipur? What is the contingency measures that you are keeping in place? Are you liaising with the paramilitary? Is the army ready to put up field hospitals if necessary? What is going on? What are some of the steps that you are putting in place actually?
The other departments like Hope Department, they are helping a lot. And not only the Hope Department, GAD Department, the Water and Sanitation Department, and Transport Department, we are coordinating each other. We had several rounds of meeting with the different principal secretary, with secretary commissioners of all the departments for helping each other, out of which this Home Department, including this Manipur Police and this others forces like Assam Rifle, CRPF, and all the others forces are also helping us for this giving the awareness in the fields and for the picking up the personnel from their home to the quarantine places. They are also very much helpful, and they are ready to help us. So I think there is a good cooperation between other departments like Home Department and us.
Okay, let me quickly go to Mr. Tabin. Mr. Tabin, there are some reports in the social media that some non-tribals have been targeted in some of the places because of panic, because of fear. Is it true? And what is your appeal to the people?
No. That is a wrong news being spread. Nothing as such is here. We are maintaining all cordial relations over here. We are helping each other. Only thing is that we have recommended 4 or 5 cases which I would like to share to you. Apart from this mandatory isolation of incoming people for 10 to 14 days, a strict enforcement of lockdown orders. And secondly, we have asked the government for maintenance of buffer stock of essential items, medicines, sanitizers, and disinfectants. And thirdly, we have asked the government to completely ban the inflow and outflow of the people. And compulsory imposition of debit card for the essential items. Vendors should be asked to use this instead of cash, because cash carries that virus. May carry that virus. That's why we have urged upon the government to impose utilization of this debit card system. That also should be properly sanitized. And apart from that, the vehicles coming from outside, before reaching the outskirts of the town, it should be sanitized for at least.
Okay, these are some of the suggestions which these are some of the suggestions that you have put up to your own government. These are good suggestions. I think the government should take initiatives as far as possible, but certain things are extremely difficult and complicated to carry out under the circumstances. The government, I'm sure, is doing your best. Now, Dr. Kikon, the Assam Health Minister, Dr. Himanta Biswa Sharma, today, he has done a very steps that has with a lot of foresight. He has converted an athletic stadium into a 1,000 bedded quarantine center. One athletic stadium, which was the center during the national games in Assam, that has been converted into a 1,000 bed quarantine facility that is coming up within the next 1 week. This is just one of the steps that the Assam government has taken. This is not for treatment, only to keep people under quarantine. Now my question is, is the Nagaland government, may not be 1,000 bed, maybe 100 bed, do you have a similar preparedness? Do you have a similar facility?
Yes, yes. Certainly. Here, I would like to inform the audience that the Chief Minister is taking personal interest in all the activities that is being undertaken, the preparedness and the response. So in that way, our state has also declared that 3 hospitals we have identified which will be COVID hospitals. So they will be treating only the positive COVID persons. Now, on the other hand, we have also identified and for full quarantine facilities where even this morning our Honorable Chief Minister has personally gone and inspected 2 quarantine centers which are in and around Kohima. Similarly, such quarantine facilities have been identified all over the state, and of course we can't expect as one quarantine facility like Assam where 1,000 people can be accommodated, but in our state, at least in 2-3 locations, we can 100 to 200 people, and that will be expanded as and when the situation comes to a point. If we need, if the situation demands, then the facilities will be expanded, and those sites have been also identified. So here I want to also make one request. Like last time in your platform, I had also made one request to our respected Principal Secretary of Assam, but here I would like to make one request to our respected Additional Director General of Police Assam. Now, with this lockdown, we are having problems with transportation of samples from Nagaland to different parts of Assam and also to Manipur.
Okay,
so
let him respond.
Yes.
Let him respond. So basically, Dr. Kikon, basically, Mr. Harmeet Singh, Dr. Kikon from Nagaland is saying that, you know, their designated testing centers are either in Dibrugarh or in Guwahati. So they're having difficulty. Their vehicles are coming difficulty. So how can you help them?
Wasbir, it's not a problem at all. Please give us the details. We've already tested samples from Mizoram and Manipur. So I don't think there's any issue.
Sure.
In case you're facing any problems, the easiest is that you share with us the number of the vehicle that is coming, the person who's in the vehicle, his phone number, and we will facilitate. We are all in this together. Even if you want us to take the people from there by escort to the nearest hospital in Dibrugarh or Guwahati where the testing is happening, we'll do it. We are in it together.
I think,
please don't worry.
Dr. Kikon, that is a very clear-cut assurance from one of the senior-most officials of the Assam Police. Mr. Harmeet Singh is assured that, you know, just get in touch with them through the police counterparts. They have all the numbers and contact details. Just give them the vehicle numbers and it will be done. It's very simple. That's what he said. Don't worry about that. Let me go to Dr. Warjri.
Thank you very much. Thank you very much for making this platform so that we can address our individual state problems on a wider platform for the notice. Thank you.
Wasbir, you can share my number with them. So
I will share number. I will share Mr. Harmeet Singh's number with you after the program is over. Now, let me quickly also go to Dr. Sinrang Warjri. Dr. Warjri, you know, a lot of people are saying that, you know, like a lot of people in the rural areas are still coming out. They are still not aware that the do's and don'ts are not been translated into the local language. So is this a problem?
Well, there are reports here and there of people not really understanding the gravity of the situation.
Yeah.
They are still coming out of their houses. They're taking it as a holiday kind of a. But I think slowly the message is getting across, and I can see a lot of media. The media is helping out. The local NGOs helping out, and people are beginning to understand the situation. And we have a lot of the WhatsApp and Facebook and everything is working in favor. And people are now beginning to understand how important it is for them to stay inside. So I think it's working. It's working. It'll take a few days, but I think it's working.
It's working. That is the good news.
I think what is more important is
Carry on. Finish your point.
Yeah. What is more important, I think, is for essential commodities to reach them, because we've had a lot of reports about people not getting enough, people who are daily wage laborers especially, and they live every day hand to mouth, and they're getting a lot of problems getting food, getting essential stuff. That is a bit of a problem here.
Right.
And those things we think we need to work it out and work out fast. And
absolutely.
have to work on that.
Dr. Rajo, thank you very much. Thank you very much, Dr. Warjuri. Dr. Rajo, your final comments. I'm running short of time. Your concluding remarks. Dr. Rajo.
Okay. I do appeal to the people of Manipur not to be apprehensive and panic because of the one positive case in Manipur, and the government is taking all the possible measures to contain the disease, and please avoid the rumors and criticizing each other, and this thing we have to avoid. Let's just help each other and let's work together to control this, to contain this infection. So I seek the help from all the sections of the society. Thank you so much.
Thank you. Dr. Rajo, thank you very much. In fact, it is the participation of panelists like you that makes such a program meaningful. After all, you and I are working at this juncture, you and I, all of us who are on this panel are working towards the same objective as to how to create awareness, how to fight the disease. That is what is our single motive, and that is what we're all working together. Your final comments, Mr. Tabin from Itanagar. Final comments, 20 seconds.
This is in fact a noble venture from Northeast Life. As we have in the press release, we have said that prevention is the only solution in this instant case, or that is by isolation. What Hamid Singh sir had said, individual social responsibility should carry forward. Everyone must feel that. And the nation has to fight together because most advanced nations like America and European nations have also surrendered this pandemic. Solution of this way out is only isolation. We should fight together, uniting the nation as a whole.
Thank you. Thank you, Mr. Tabin, for coming on the show. We would have been extremely happy if also the health authorities in Arunachal Pradesh would have been coming. We have been requesting them to appear on the show from quite some time, but for some reason they are not coming on the show. I would still request them. Our doors are open. Please participate in the show, not for me, but for your own people, so that we can jointly fight. You can also assist through your comments. A lot of people watch the program, and that is the reason why I am saying, Mr. Harmeet Singh, last words to you. What are some of the 2-3 points that you would like to make at the end?
Simple points. Do not go out of the house until it is most essential. Keep cleanliness and hygiene in the house. Keep washing your hands. Keep everything clean. Number 2, if you go out, we have made arrangements. We have told all shopkeepers to keep social distancing. I would request shopkeepers as well as all sellers and the public to ensure that they keep social distancing amongst each other. Number 3, help people around you. And number 4, if you have heard of any such case, reach out to us. The state government task force under the Chief Secretary meets every morning. You reach out to us with any problem that needs a policy decision. We will take it up at the Chief Secretary's meeting, and the government will decide for the people, because the government is working only for the people. Let's work together and end this problem once and for all.
Absolutely. That is the mood. That is the message. Let us all work together. I expect the people should not be talking only of their rights. Now is the time to demonstrate your responsibility. At the end of the day, as I said in the beginning, we are now in a situation where there is a very, very unwritten contract between the state and the citizens, and it is our time to stand together, but the government and the citizens, and fight this deadly disease. On this note, I end this edition of Notice Tonight. I thank all my panelists who are extremely busy people for appearing on my show and talking so much of sense for the sake of every one of you. I thank also the viewers for watching the program. Good night and goodbye.
Northeast Tonight, brought to you by Oil India Limited, conquering newer horizons.